INFM700 Capstone Final, Healthcare Clinical Transformation by Jamon Hawk, Mercer University, Spring Semester 2019, Instructor Dr. Bascaron. Acknowledgements. I would like to express my special thanks of appreciation to my professor, Dr. Bascaron, for his fastidious, educated leadership, encouragement to finish this project, and for giving me the chance to do this awesome venture on clinical transformation. Without his direction and inspiration, my task would not have been such a learning experience. Secondly, I want to express my sincere gratitude to all of the employees of XYZ Healthcare for their advice, their assistance, as well as their contribution in this undertaking. By taking my survey, providing me with data and the criticism, and by completing the surveys in a timely manner. Thirdly, I want to thank my family and friends who helped me a great deal in finishing this venture inside the restricted time span by helping me in completing a ton of research in which I gained knowledge about a significant number of things. I am extremely appreciative of them and incredibly thankful. And lastly, I want to thank every one of my colleagues who stayed up long nights with me through this exceptional, tedious course, and without whose participation, the course would not have been a euphoric moment. So thank you all. Executive summary. XYZ Healthcare main goal. XYZ Healthcare main goal was to help the human race by cultivating well-being that characterize their main determination for the patient care. This determination drove that eminent oath to the patients that they help, and actually the care renovation design was really major when conveying on that eminent oath. So that design was the way to deal with changing consideration that has gone from reclassifying and ceaselessly improving the experience that patients, their families and guests, as well as their staff and doctors have over the organization as a whole. What does this study suggest? Well, this study suggests that several providers organizations have an administration vow to make providence to reassure that change yet needed to enhance the information capacity and the human resources to put the procedure into actions. So for example, the people that had responded to this survey, or the participant that responded to this survey about the clinical transformation, they demonstrated that their organization is at the present moment either organizing such a team or they already have a clinical transformation team set up. What does the transformation include? Well, with that being said, clinical transformation pretty much includes evaluating and ceaselessly refining the manner in which the continuum of care of patient is conveyed at each and every dimension in a healthcare organization. There was various upgrades that associations figured they could take to improve the capacity to utilize clinical transformation to improve patient results. And for example, information is not constantly accessible in a way that encourages simple access and reporting. So therefore, a clinical transformation would include something along that line to actually help with that. The project. Well, for this project, analyzation of the framework granted proof-based care delivery with insufficient experts group fluctuation. So furthermore, for this project, analyzation showed how the framework provided solutions that focus solely on the best data accessible, conveyance with slight changeability, and had the capacity to gauge and report at a high level of granularity that most organizations could convey today. So therefore, concentrating on clinical transformation is a method for attending to issues and trusting that the country's healthcare providers need to incorporate conduct and this physical consideration. So when you think about the entire individual method, it doesn't mean that you just thinking about the brain and the body, but you're also thinking about the soul of the individual. So furthermore, bringing psychological wellness and substance use administration to the areas that individual needs the most will ultimately prompt the clinical change, in which I will be discussing in the next slide. Introduction. Having a new EHR based apparatus to utilize data inside the facility just as access to data about consideration that happen past any kind of center dividers. You have providers who are adjusting their train work process so as to more readily think about their patients. Now, with clinical transformation and execution improvement being reinforced and driven by healthcare IT, there are key zones of centers for all networks since it can build up like a culture of nonstop quality improvement. Now, a definitive part of any clinical change is to improve the well-being of patient populace through like a more financial, like savvy frameworks of consideration. And a key asset for encouraging that is like a culture of ceaseless improvement in like the clinical practices and its innovation itself. Now, however, instruction like a culture of consistent quality improvement. You do need like networks and clinics should definitely like concentrate on like the objective setting as far as establishing like an interdisciplinary development team. Also as well as like preparing their staff on any kind of progress techniques and apparatus, as well as testing and like continuously the assessment of concepts to improve the transformation earlier during the process. The clinical transformation will definitely incorporate like a reliable and cultivating way to understand like innovative methodology that has been passed on in like all measurements in a range of consideration affiliation. Now, with that being said, the research question still stand is like what strategies are the clinical service association using to like impact the advancing developments and like the persistent healthcare condition to actually push transformation. Now, through any kind of clinical transformation, it will definitely occur when like an affiliation disposes of any existing like clinical plan that passes on inefficient or any kind of like less fruitful results. Um, and also like handles like a common goal of patient safekeeping, such as medicinal results, quality deliberation over any kind of strategy redesign, as well as any kind of data innovation that has been utilized. So conducting any kind of feasibly like blending these people techniques and advancing like a clinical transformation will actually transpire they'll transpire over like any kind of workplaces, branches, or any like medical grounds of expertise. Sorry about that. Um what else? The clinical transformation would definitely like focus on certain goals, such as like any kind of improvement that needs to be done within the clinic, advancement, as well as methodologies, as well as the organization itself and any kind of ideas. Now, however, you got to think about it now, like through this transformation, the organization must fathom that parting on to like a any kind of change technique will require like advancing assistance, such as benefits from different individuals, as well as for the accomplishment to be made like sense of. So in addition to that, like it also would like involve in like a non-stop relationship between like the medical personnel and any other experts with a like significant understanding of patient care and how it is truly passed on in the affiliation. Now, be that as it may, regardless of any kind of developing changes in productive philosophy, like there's like various level like helpful clinical change or clinical transformation um, with obstacles inside any kind of organization to have the ability to accomplish such goals. But nonetheless, like being short of usage and like reasonable clinical information structure to help data social affair such as migration and information appropriation to engage the reliable movement of clinical administration over various providers and environment. um, will any clinical change happen? Research design methodology. Utilizing quantitative and qualitative strategies in like a solitary report or arrangement of concentrate so as to like explore a wonder of endeavors to address an exploration questioning. Mixed method research incorporates gathering, breaking down, as well as translating that information. Now, in a successful mixed method research, the approaches pit will have shared quantities and no similar shortcomings, ultimately resulting in a thorough look at the exploration issues from numerous point of view and will offer like a more complete picture while dissecting the results. Now, when dealing with mixed method research, of course, in the design, you do have you need to understand the qualities and shortcomings of the approach, and this here will decide if like the mixed method strategies are proper for like a specific research venture. There are numerous quantities and shortcomings when managing a mixed method research, but knowing these quantities and shortcomings is basic to having like a fruitful research venture. Now, with any kind of research design, you will have strength and weaknesses. Now, the strength when dealing with mixed method research is that the data incorporate figures, insight, terms, images, and it tells stories. Um, and it be utilized to address like a more extensive scope of study, inquires in light of the fact that there are more than one methodology that can be utilized. One method quality can pretty much utilize to beat the shortcomings of another, as well as like outcomes from the technique may approve each other and give more grounded proof to like an end. Another strength would be like they include like bits of knowledge of comprehension that might be generally missed, and as well as increases the general scope of outcomes. Now, the weaknesses when dealing with mixed method research is that quantitative or qualitative techniques may be like the only training that the researcher have, or they the only thing that they may be accustomed to. Also, selecting the fitting strategies and making the general plan of the examination venture might be all the more difficult, as well as it can be hard to deal with any kind of undertaking if like the two techniques are being utilized at the same time. And then also, like when you're dealing with mixed method research, it can definitely become like very tedious to actually find the information that you're looking for. Informatic components in the project. The healthcare is in need of change. So, major personnel and healthcare organization, as well as like different federal agency and policy making organization, are emphasizing the importance of evidence-based practice. So now, using this problem-solving approach to clinical care that incorporates the conscientious use of current best evidence for well-designed studies, the clinician expertise and patient values and performances preferences, nurses and other healthcare providers can provide care that goes beyond the status quo. So therefore, the healthcare that is like that would be evidence based and conducted in a caring context leads to a better clinical decision and patient outcome. So gaining knowledge and skills in the EBP process will provide nurses and other clinicians the tool needed to take ownership in their practice in transformation healthcare. So key elements to ensure that best practice cultures are EBP mentors, such a partnership between academic and clinical settings, are EBP champions, are clearly written research and time and resources, and as well as administrative support. So now, characterized like through the total association of the framework and the stream of information and data among the critical partners of the framework. Patient is viewed as the most essential item within any clinical service framework, and on the grounds that the vast majority of the data is centered or created by the patient. So like the model speaks on how the patient goes into the framework, beginning with the registration procedures to confirmation, analysis, treatment, and other related exercises. So it likewise will speak on the utilization of suitable information and communication technology wherever required to improve the healthcare administration as far as time and quality and usefulness. So when you talk about the information and communication technology, it assumes like a fundamental job in the advancement of well-being data framework for knowledge management, as well as they will aid in information accumulation, investigation management, and sharing of the data between like the business forms of the clinical services. Proposed solution and activity. The new HR will be centered around like giving better care to patients. There were a lot of things to consider when implementing the new HR system, such as the type of system to use, what application will be used, etc. So therefore, like the new EHR would be like more interactive to like prompt the user for additional information. And by doing so, like this will not just help gather more information, yet additionally, it will like upgrade the user fulfillment. Also, the new EHR framework will be like centered around the aggregated health, of the patient, and the software would be like proposed to link historically like the health association that originally like collects and accumulates the like information. Also, it will be worked into like impart data to other healthcare providers, like for example, research facilities and specialists, so that they can access data from every one of the clinicians associated with the patient's care. And after like careful deliberation, a cloud-based system was like the right choice for this. So the reason for executing this system configuration is to like make a superior work process and usability for the care coordinating planning. The clinical transformation will concentrate on like vital targets that like ordinarily spring from like the operations of one of the further developed clinical data frameworks, such as the EMR, the electronic medical record, the clinical documentation frameworks, also the CPOE. The electronic medicine organization record frameworks, or the clinical decision support system, or the CDS, um, the CDSS. By considering a portion of the main idea will make a creative system for actualizing a dream-driven venture or a set of activities such that like the administration can advance reception by utilizing like best practices into transformation supervision. Along these lines, like with the clinical transformation programming and procedure change or strengthened with like end client receptions, measures and utilization of progress standards. So the new innovation is incorporated for considerable effect, which will accomplish boundless client selection. It will also establish a framework for the future activity and advance the association clinical targets. Concluding remarks. The clinical transformation initiative actually pursues an imaginative and cooperative approach. And there was there was pretty much five main approaches that it actually pursue. And one, it wanted it express the issues and distinguish obstacles to like look at when dealing with this venture. Also, it accumulated proof to recognize holes and hindrance. It investigated outcomes by breaking down and translating discoveries, as well as it finished arrangement by creating suggestions and apparatus. And last, it was a steer selection through like broadcasting and actualizing proposed instruments. Now, the transformation would be, it was expanded worth with goals too far past like direct programming foundations. And by having a foundation, the medical personnel had the ability to develop an application utilitarian with the consideration of typical helpfulness. And at the accompanying measurements, by utilizing a medical center progressively imperative perform like standpoint through orchestrating and sorting out of like strategy transformation. Now, with accurate or genuine transformation, software design and method transformation were sustained with customer gathering procedure and use of advanced methodologies. Now, newly developments are composed for significant impact, achieve expensive customer gathering, build up a structure for forthcoming exercise, and it also like develop like the affiliation medical goals. Now, at whatever point the people in the administration, advancement, and strategies or organization ideas all got together, like the transformation is a staggering strategy to make tries to improve social protection movement. So clinical transformation begins not with an innovation plan, but yet with an obviously verbalized vision of the ideal end state. And so the idea may concentrate on the patient healthcare, and as well as the client administration or any numbers of results. But clearness as far as how the ideal advances the association quick undertaking while establishing a framework for imminent activities is imperative. So influring in the endeavor that vast, it is pretty much critical to insinuate that the clinical transformation should scrutinize the present state affairs. And this will mean like a viable dimension where the transformation team will be urged to address built up strategies and methodologies. These are my references, and this is where I got most of my literature reviews as well as a lot of my information from. So of course you can see that there was a lot of research that took place with this, and that's it. This is my appendices, and within my appendices, I did have a few documents that was located in there, such as the IRB, which is a institutional review board form that deals with any ethical issues that I may have had any concerns with any ethical issues when dealing with this project. Also, I had the project plan, which actually broke down the structure of the project itself. Well, not necessarily the structure, but just gave you the main purpose as far as the scope and details that goes along with the project. I had the work breakdown structure, which actually broke down the structure of the project itself, as well as any contingency plans that I may have needed within any future contingency plan that I may have needed if something didn't go right. These was like my backup and everything. Also, I had the survey responses of all the participants that played a part in this, that actually took the survey and filled it out in a timely manner. I also had a Gantt chart, and the Gantt chart, it's pretty much it's just a time frame of everything of my completion dates, um, the time when something start, when something end, as far as the predecessors and everything, and it was pretty much a breakdown of all of that. And as well, I also had my checklist, which made sure that I had everything in order and made sure everything was being completed in a timely manner.